All right. Good Friday morning to everyone who is joining us. Thank you so much for being here. We'll just give a few seconds for people to get into the Zoom room, and then we will get started. And actually, Chris and Molly, this portion of it, we can probably just get started. Are either of you okay to start with just a quick introduction of who you are?
Sure. I'm Chris Adrian. I'm a pediatric palliative care doctor at a large children's hospital in Los Angeles. Before I did palliative care, I worked as a pediatric oncologist as part of a bone marrow transplant team. Also trained as a chaplain and as a psychedelic guide, and I'm part of a group of Canadian, American, and Jamaican clinicians that take parents to a retreat in Jamaica, take bereaved parents to a retreat in Jamaica to work with psychedelic mushrooms in the hope that that will help them with their grief.
Wonderful, thank you. Molly, you want to go ahead?
Hi, I'm Molly. I live in Indiana. I was in ministry. I was an administrative pastor for 10 years before I was a caregiver for my daughter for 10 years. Right now I'm doing grief coaching. I'm working as a hospice chaplain and writing.
Well, thank you both so much for being here. So Molly and Chris are going to be speaking on what it is to navigate terminal illness in children today. So we're going to go through some slides with them, and Molly's going to share her experience, and Chris is going to chime in with his experience on the clinician side of things. So the hope is that as they go through these, our attendees will have some questions and will want to check in and ask. And once they're done with their slides, you can do that in two ways. You can raise your hand, you can click the raise hand button, and we will unmute you and you can chat with Molly and Chris. And if you prefer not to do that, you can type it into the Q&A section and I will read it aloud for you, for Molly and Chris to answer. And the chat is also open. So if you have any thoughts or just something comes up while they're speaking on these topics, please feel free to add it into the chat. We are absolutely here as a safe space for whatever bubbles up during this conversation. And thank you so much for being here. So with that, Molly, I'm hoping you can start by introducing us to Izzy.
Sure, that's Izzy. Her full name is Israel Marie. And she was just an extraordinary, extravagant soul, truly. So she loved nature. She loved animals. I think she sensed a connection to those things spiritually. I think she was a seer with her soul. She could see things and sense things, and I don't even think she was aware of it most of the time. But yeah, she was diagnosed with cancer when she was 3 years old, and then she was finally set free at 13. So that's all I got.
Can you, Molly, will you say a little bit about that outfit?
Yeah, so Izzy loved to dress up. She she was very self-conscious about her size, being so small from treatment, and not having much hair, but she very much thought she was adorable. And so she loved to get fancy. And this was just out back at the creek. We'd do photo shoots all the time. We would buy dresses just for her to take pictures in the backyard. So yeah, I think she actually wore that particular dress for a fundraiser for a local children's hospital. But yeah, she was just all about being the center of attention.
The illness that you all were navigating for such a long time was neuroblastoma. Am I remembering that right?
Yep, absolutely.
Okay. Well, Molly, I wonder if is there something maybe that comes to mind right away for you that you just wish you had known, or you wish another parent had told you, maybe even just in the most general way to start with, or something that you've but something that you've that feels important to share.
I mean, I think really just to trust your gut. Izzy was experiencing symptoms for 9 months before we got a diagnosis. And it can be difficult. I mean, her symptoms were so vague because it was just stomach pain. But even though the doctor wasn't impressed by them and we thought it was something GI or an allergy, I could see that the pain was getting worse. The episodes were getting more frequent and they were getting more intense. And so it just didn't feel right. It continued to feel, I could see that something was getting wrong. It was waking her up in the middle of the night. She'd scream in the fetal position. And so, yeah, I think it's just important that parents do remember when they walk into a doctor's office, the doctor is going to present what's most likely, what's most reasonable, what's most rational. And as parents, we can sometimes be a little over assertive and freak out about things. But in my gut, I knew that constipation would not wake someone up in the middle of the night screaming for an hour. And then I would do an enema and there's nothing to come out, So I think you just have to trust yourself.
Yeah, I hear you describing. That was a story that was familiar practicing back when I was an oncologist. That many parents would come. The family would come to the cancer diagnosis, having said something's going on, something's going on. And exactly as you say, the pediatricians are looking for. They think of what's common, not of what's not of the rare thing a lot of the time. And so there's an immediate that like the parents come in already with having been kind of tested and formed in having to negotiate with the medical system around their own authority as parents or their own expertise as parents. And even though we say this a lot in pediatrics, you're the expert in your child, and there is a model for shared decision making. My sense is a lot of parents still, for the things that really matter, sometimes it stays frustrating. As you moved out of her initial time of treatment, how was it in terms of did people listen to you? Were there times when that frustration or that sense of, I think I know what's going on, I need to help the team see it, or I need to help the team do the thing that or manage the team in a way that gets my child what they need? How was that? And do you have thoughts for parents who may be trying to negotiate that kind of put political in a way space?
Yeah. So when Izzy was first diagnosed, she just had surgery and that's all it required. We were told there was less than 3% chance the cancer would ever come back. It was just in the left adrenal gland, had not spread. And so it was 6 months until it came back. We were scanning every month for the first 3 months, and then we spaced it out 3. And then it had come back and wrapped around the kidney and spread to the bone. And at that point, we actually switched teams and started going to a specialist in Ohio who specialized in neuroblastoma. And when we started working with that hospital, I realized for the first time, I think as a parent, I always felt walking into a doctor's office that I was trying to convince them that I felt like it was me against them. And for the first time, I realized with her life on the line, I needed to be on the same team as them. I needed to realize that they wanted to help me. And so I really changed my tone. I changed the way I interacted with the doctors, and I listened to them, and I wasn't as combative, as I had been. My son had some other issues prior to that. And what I found was that we got so much more accomplished. When I listened to them, they listened to me.
I'm going to change this right here just because it seems like this is exactly what we're talking about. Sorry to interrupt.
No, you're good. So yeah, I think that allowed us to get so much more done. And, you know, to this day, 10 years later, I still have a relationship with her doctor. Because I stopped fighting against people and said, you know, we're not going to do this unless we do this together, you know? So I think that can be a thing with lots of parents. I remember on the floor, I would see them get frustrated, and they were so frustrated with what was happening with their child. You know, they're not listening to me. I want to do this. I want to do that. But then they would get so aggressive and so combative. And it's like, that doctor doesn't want to work with you. Like, you're pushing him away, you know? So yeah, I think the key is just to remember that the doctor's in that space for a reason, because they want to help, you know, and that helped us a lot. Even when I didn't agree. I remember Izzy had an NG tube in the very beginning, and she would vomit it up several times a day. And I had asked for a G tube. And my doctor was like, no, you know, we're not going to do that. There's too much risk placing it, blah, 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 blah. And I said, you know, he told me all of his reasons and all the things. And I said, okay. I said, well, I'll talk to you tomorrow. And he's like, why would we talk to me tomorrow? I said, because I'm just going to call you again tomorrow and we'll have this conversation again, you know? But I wasn't mean, and I wasn't, disrespectful. I just wanted to keep having certain conversations. But I would do that in a way that was honoring, and we got farther.
Yeah, and I hear what you're describing. Like I hear you describing a way to still stay authentic and true to yourself as a parent. But get your child what they need. The other thing that comes to mind is that something that comes up for our team and for my hospital a lot is that I think maybe in healthcare in general, but certainly in pediatrics, it can be, we don't get a lot of training in how to be with or hold other people's emotions. And so when we do in palliative care and some other specialties, but I think that sometimes the providers just become scared, even if they may not be totally aware that they're scared or want to admit it, and that just really throws a wrench into communications. Maybe I could ask you to speak a little bit to hard conversations. You know, maybe thinking back to, because I imagine there were times in the whole journey of the illness where something shifted for Izzy, or people became much more worried suddenly. What was can I ask about your experience of people bringing that information to you? Oh, we're very worried, or maybe that they're like what they saw wasn't necessarily what you saw. Were there ways that were helpful for you, that people when people approached you with those kinds of conversations, and were there things that really were there conversations where people really just fell on their face when they were trying to bring you into that worry space? Yeah. So, you know, over the 9 years that we were in Cincinnati, we got to know the solid tumor team very well. And initially, my doctor was the one that I was the least impressed with, because he was just awkward, and he wasn't like as personal and as extroverted and fun as some of the other team members were. But ultimately, when hard conversations had to be had, he was the only one that could engage in them with me, right? So the other practitioners, what I saw was I never saw anyone say we're worried. It was this beating around the bush constantly, right? Where Dr. Wise had this ability to just say what was real, you know, like, she's likely not going to survive this, like 7 years before she died, you know, like, just to say the truth. And that's what I feel like more often than not, in my experience and in other parents that I've worked with experience with kids, I just feel like doctors tend to like want to sugarcoat it and want to give hope, because that comes from like this place of compassion and love and all the good things, but it can be misleading. And so that's what I felt like I was getting from all the people that I initially wanted to work with, who were so fun and bubbly and all the things, wearing their costumes. Whereas Dr. Wise was just like, yeah, this isn't good, you know?
But that's what I needed to make informed decisions, was to know what was really going on.
Mhm. Yeah, so it sounds like you found your person.
Definitely.
Mhm. And yeah, but something that comes to mind for me is that, again, I think it comes down to it. In some ways, it's like a disposition thing for folks who go into pediatrics. Just how hard it is, even for people who work in the space, who work in the oncology space, for instance, to be in that space of admitting that this is not going to work out.
Yeah.
Oh dear, there's lost my train of thought. I'm gonna get it back again. For those, maybe I can say this, that if for families where you may notice, oh gee, I think this practitioner or this clinician is having a hard time saying something to me, you can ask. You can say, look, I need you. So sometimes that's all the clinician needs is permission, or even it's a little help shifting their own awareness about what you need, because they may be trying to give you, as you're saying, they may be offering something that is not what you need. So you can ask for what you need, and I think very, very often that will help redirect the person. You can, and I mean, I'm sorry it's this way. It's hard enough being a parent in this situation. You shouldn't have to do this. But given the nature of just how fraught and complicated communication can be inside the hospital, sometimes that's what you have to do.
Chris, can I ask you a question on that?
Sure.
Is there an example, or maybe two examples, of how someone can structure that question to their clinician to say, I need you to give me X? Like, what is an example that a parent or family member could use in their own situation?
Yeah, we like Molly, I think you were saying like no one told you they were worried. But that, I think you can, a parent or a family member can use that worry language themselves. And one way I was taught to phrase it when I was learning to be an oncologist was one way I was taught to bring parents into to keep checking in that space of making sure everyone's on the same page, was to say, I need for us to kind of share the same level of worry. So if I'm very worried, but you're not worried at all, then that's probably that's no good. And if you're extremely worried about, and I'm not worried, then also you may be worrying more than you need to. So we don't have to be exactly on the same page, but we should be kind of in the same ballpark. And then the other thing that was taught as a matter of course for me was to say in that first conversation, as soon as where you verify that this really is something serious and life limiting, and verify that it is a cancer, was to say, I need you to know that this, and that even for a very treatable leukemia, there's a chance that your child will die, and that we won't succeed in doing this. I'm going to say this now because you need to hear it, and then we're not going to worry about it. We're going to proceed to try as hard as we can to cure your child. But I also need you to say that when I worry that we're shifting towards that again, I will tell you. I promise I will tell you. If I'm not telling you, then you don't need to drive yourself to distraction with worry. So those were the things that I learned as a physician in training. But I think parents can just flip that the other way around and say to your clinician, I need you to tell me how worried you are, when they're bringing new information, or anytime really. And then also, that parents can, even for a clinician that doesn't volunteer that promise, you can ask that of them. You can say, I need you to, I need you to tell me when things are going in the direction that we named on that first day. And then does that add up to something, Sonia and Molly? How does that sound to you?
Yeah,
Yeah.
absolutely. I'm also wondering, Molly, what your experience is with this, and Chris, same for you, is kind of navigating how much you do want to know within that moment, and also framing questions around that. Because Molly, I'm assuming we're going to get to a slide on timing, that at certain times you were kind of in a different headspace of what you could hear in that moment. So is there, Chris, do you have any suggestions on that for families on how to say, I'm in this space and I can handle this much, but I don't want to know X?
Sure. Yeah, and I mean, I should say a palliative care team can help, or with all this stuff. They can be and a communication ally. One of the things the palliative team will routinely ask parents is, can you tell us about your communication style, or what your preference is? And then a parent may say, I don't know, I don't think I have a communication style. And then you can help them in conversation, help them discern just that. Here's what I want to know this much, but I don't need all the details, or I'm a detail person. You need to tell me everything. And that conversation also will usually incorporate or involve the child, because that's another question that you can that I routinely ask, and again, information that even if you're not asked, that you can share with your medical team is, I'm like, my child wants to know this much, or my child wants to know just wants to know what's going to happen next week. And others might say, no, I really want to know. I want to know everything. Yeah, maybe to try and answer that more succinctly is you can just tell people, and the frustrating thing is that they will need to be reminded very often. Also, like, teams change so often that you're like, they're new faces all the time, so it can get fatiguing and frustrating to have to tell people this all the time. But I think they will listen.
Yeah, someone wrote in while you were saying that, Chris. I'm guessing this is an example of kind of how to frame it is, I sense there is more behind what you're saying about X, Y, or Z. Can you please slow down? I'm ready to hear whatever it is you have to say. And Chris, your note about teams changing, I'm wondering, Molly, if you can speak to that too. I'm assuming that was an experience you also had, and I think that links to maybe self-advocating and having to do it over and over and over again with new teams of people.
Yeah. Our team, the problem we had was a little different. It wasn't so much that our team at Cincinnati changed. It was that because we were 2 hours away, if we would get admitted locally, I mean, with a fever, Izzy had sepsis multiple times. I mean, when we would be admitted here, then getting this team to communicate with Cincinnati, and then you add COVID on that. I mean, it was just horrible. So I think that's just a hard thing. I think being transparent and asking clearly what you want to know. And as I'm listening to us all talk, I'm thinking just specifically about what is the goal right now, right? Like, how many times, that was really what I was getting with a local admission, right? Like, I don't need you to talk to me about her future. What do we need to do to get her home right now? And there were some times with our team in Cincy or here where I would just say, I don't want to talk about next month. I'm not ready for that right now. We can talk about that later. So I think always asking what the goal is, especially when you're bringing in new treatments. So many times people will talk about, like, oh yeah, we're going to do this new treatment. And I think, but did you ask the doctor what the goal of that treatment is? It's probably still not to cure the way you think. Right. I mean, we always hope for a cure. Everybody hopes for a cure. But so often the goal isn't to cure because they've dismissed that idea. You no longer see it as a possibility. The goal is just to extend life, prolong life. And that was so helpful for me to know along the way, because my goal wasn't a cure for more than half of Izzy's life. It was just to give her longer life, more quality of life. So I kind of went off on a tangent, but goals, I think, are really important.
No, absolutely. Molly, I think, that clarity that you had, I imagine, it must have been, that clarity that you're describing. I feel like it's so valuable, just to get, to make sure that you're getting care that actually aligns with your values, which is what palliative care is supposed to be, supposed to help make sure happens. And I wonder, were there, like, maybe could you say anything about, like, were there ways that you, again, maybe this goes back to trying to help the team to take the best care of your child, but were there times when that clarity, when people couldn't meet you in that clarity, or they couldn't, or they didn't seem to be able to, sorry, I'll say it this way, where your values were very clear, but you couldn't, but there wasn't a sense that the medical team knew that their values were clear, or times when the medical teams, or the sort of the hospital system's values seemed to be prioritized over yours?
Yeah. I guess my answer to that is that mostly where I saw, I don't know, a disconnect is when, it would be in that, like, changing of the guard, right? So we were inpatient so many weeks and months and all the time. And so, whoever was attending for the week, we would be on a solid plan for what was required for discharge. And then the changing of the guard would happen, right? Or maybe we wouldn't be assigned an attending, we'd just be assigned a resident, or a fellow. And so the levels of constantly having to, and that's where you just have to advocate, and you just have to speak for yourself. I need you to know, these are my goals. This is where I am. I remember a doctor she wasn't an oncologist, and she was in the room, and she began talking to me about, like, Izzy's disease progression and what was likely to happen, and her not being able to walk again, and all of these things. And that was really offensive to me, because she was making predictions about scan results that I hadn't talked to the oncologist about. And so I think it's also important we can set up boundaries. We're allowed to do that, and say, hey, I'm not comfortable having this conversation with you. I need to have it with this person, and that's okay. So yeah, I think that's important too. I don't know if that was helpful.
Yeah, and I've noticed some parents, or had parents describe that, they have their team, and so when someone else tries to sort of butt into the decisional space, or prognostic space, they stop them and say, look, I appreciate this, but really this is something I only discuss with my core team. But thank you for trying. One other thing I wonder about is, it's because I hear it's something that the parents I work with describe struggling with, is just sort of coming into any kind of newish clinical space, and having, especially for and having people approach you, or sort of ask, maybe they may not say it out loud, but this sort of vague but pervasive sense of, oh, does this parent get it? Or a sense that, oh, do they not? Being handled as if you don't, you're in denial. People use that word all the time in the hospital, even though I think, like, I've never actually met a parent in denial about their child's illness. But anyway, does that make sense as a question?
Yeah, and I think sometimes that assumption is made. I didn't survive for 10 years through our cancer journey by always fully embracing that she wasn't going to live. I mean, sometimes I chose to disassociate from that and put that aside, and that's just how I survived, And so I think there are times when people can be in denial, but I think more often than not, we allow into our conscious space what we can hold in our conscious space at that time. And there were sometimes I couldn't possibly hold that and make logical decisions, So yeah, I think all of these things go back to just this self-awareness and of what we can hold in this space, and the awareness to what's going on in the people around us too, right? So sometimes to recognizing this is what's going on with my child and this is what she's ready for, the amount of information that she's ready for, and also with the practitioners. Keep in mind they just came from another room, so I don't necessarily know what situation they just walked out of, you know. And so that awareness, I think, I wish at the end of our journey, I'd had more of that awareness in the beginning, you know, to sometimes learn in conversations that I would have with the practitioner that was like, you know what, this really isn't about me and Izzy and our kid, right? This is about something that they're holding on to. And so just let it go, you know? So, yeah.
Well, you mentioned something just now about beginning and end, and I'm hoping we can tie this into timing.
Yeah.
And when we had first talked about this webinar, you had brought up timing and how it kind of felt at the beginning and how things changed as you moved through this experience. Can you talk a little bit about how time changed and how your mind may have shifted over certain periods of time? And also you had brought up the concept of giving up as relates to children. And I think that's a really powerful concept as well. I'm just hoping you can touch on those.
Yeah. So I think in the beginning, when anyone is looking at a diagnosis like cancer, the goal is a cure. And then when a cure is off the table, then I think the goal is, again, like the length of the life and the quality of the life. So Izzy relapsed 6 times. And with every relapse, treatment took her down harder and her quality of life diminished. And life became this thing that was constantly handed back to her on a string. And it was like, you might be able to run today, you might be able to stand today, go to school, do cheerleading today, but tomorrow you can't walk, right? Because the disease in your legs is too extensive. And she knew that constantly. That was a constant fear of her. You know, I want to do this today, Mom. No, we're going to do that next week. What if I can't walk next week? You know, that is the way I navigated parenting with her, was constantly aware she might not be able to walk. So there was this time in the beginning where it was very clear this treatment is giving her something. And then there was this slippery middle area. And all of a sudden, one day, I realized the treatment was taking away just as much, if not more, than the cancer was. And the treatment was keeping her in the hospital all the time because her counts were so low and she wasn't producing blood products. And I just suddenly realized that she had no quality of life. And, you know, I think I saw that coming about a year before, but I don't think I was quite ready to hold that. And yeah, so it was the January before she died, when she was back in the hospital again, like violently throwing up blood because the chemotherapy had just like burned holes in her stomach, like from where it was going in the G tube, and it was just sitting there, and she was in so much pain. And so her doctor, this is where goals came in. You know, her doctor pulled me aside, and he was really on the same page as me, and just said, like, we need to go back to what is your goal, because you said you wanted her, your goal was quality of life, and he just very directly began to speak to me and say, and we also need to think about what you want for the end. And that's when we started, you know, I just said, so lay it out, like, how does a kid from neuroblastoma die? What does that look like? Like, well, it either happens this way, this way, this way, or this way, with someone, you know, that's presenting the way Izzy is. And so, you know, I knew that I didn't want Izzy to die in the hospital. And I didn't know what she wanted. And so, you know, he just encouraged me. At that point, she was 12. She had been involved in her treatment decisions since she was 11. At her request, she was refusing some treatments she didn't want. And there were others that she was willing to do. So he said, if you know you want her to die at home, then you probably need to stop, because otherwise you're going to come back in for an admission like this and she's just going to die here. That's how it's going to end. So that's when I went back to Izzy and just very clearly told her, you know, we had had many conversations about her cancer not being curable and about death in the end. And and I think all of those are dependent on the child. I would not say that every child should, my other child, I would not have had conversations like, you just have to gauge it, right? But I said, we can keep doing treatment and you can maybe live another 6 months in the hospital all the time, feeling sick, or we can leave now and never come back and you can live a couple more months. And she said, I want to leave now. And I said, we can go to the beach, for a month. And that's what we did. It was her decision. I know I'm getting off into a different topic now, but it was her decision to stop. And that was such an empowering thing to give her that choice of what the end looked like. And so I guess I just tie that all together to say it was this gradual thing, but then at the end, it was so very clear for both of us that we wanted some control over the end. And she hadn't had any control for 10 years. So to give her that was, I think, a beautiful gift. Sorry, I went too far.
No,
Wrong.
That's beautiful. I think we're right where we should be. Something I'm curious to ask about, if it's okay, is where hope was for you and where hope was for Izzy during as things change. Because I think I hear you describing a way to think about hope that isn't just about an expectation of a future good, but something more like just how to find a way to absolutely not despair. And I wonder, and I think I'm asking in particular because so often for parents, I think like treatment and hope are so firmly intertwined. It can be very, very hard to disentangle them or think or imagine anything to hope for anyway, to be in a positive space to thrive in without aiming towards cure.
Yeah, I think hope was tightly intertwined with the cure for the bulk of her life. And when I would think about hope, when I would think about anything positive, it meant her being alive. I think that most parents would say that losing a child is one of the hardest things you can experience. And hope for me shifted when I realized that losing a child wasn't the worst thing I could experience. It was watching my child continue to suffer, watching her want to walk, want to go to school, want to have hair, want to not have a G-tube, want to not have to wear hearing aids, all of these things that chemotherapy continued to take from her. And I couldn't fix it, and she, I mean, those last 6 or 7 months, I mean, she had to be carried around the house because she couldn't bear any weight on her bones. And so that was the shift for me with hope, is I realized we tend to think the worst thing in the world is death, and it's just not, and when I allowed myself to see beyond this realm and into whatever is next, then hope was different because yes, Izzy is dead and that's sad, but Izzy is free and that's beautiful. This Sunday will be 2.5 years since she died. And that is 2.5 years that I have lived with pain every single day, and 2.5 years that she has not. And as hard as that is, I love that for her. And it's, so.
That's what a beautiful and powerful frame. I get the other word that comes to mind as we're talking about this is grief. And I wonder, like, looking back, do you and actually, and now as a clinician working in the grief space, do you think that just being able to grieve even before Izzy died, was that any part of finding that clarity or that assurance in what was important?
Absolutely. Yeah. I think grief was a part of our life. After those first few years that she was sick, I think we realized we were already grieving for what we had lost, and I think she was able to grieve too. She grieved for the life she wanted And she got to the point where she realized she was very fascinated by this idea that what everyone keeps saying is that there are options, that I have choices. But really, the only choices are I can do treatment and have cancer, or I can die. She was like, that doesn't seem fair, And so as she began to be in these conversations with us, then she began to grieve, because I think she thought for so long, they keep saying options, they keep saying choices. And so then when we actually sat in a room and looked at the scans, and we said, are what the choices are. And she said, well, those choices suck. And, everyone laughed, and they were like, they do, it's true. But yeah, I think grieving was, an important part of the end those last few years. And so I think ultimately when she died, there was such a relief. That she didn't have to grieve anymore. So like my grief started then, but I was relieved that I didn't have to watch her grieve anymore for the life she didn't get, the life she knew she could never have, that inner turmoil, to see that in her was heartbreaking. And so when she died, even though my real grief journey began, it was so beautiful to know that she wasn't grieving anymore and hers was over. And, for me, I look at that as like a handoff, with her last breath, right? Like she exhaled all the pain and all the grief and all the sadness and the suffering, and I inhaled all of it. That's how I view that final moment. And I think that's what a mother's there to do, to take that away so their child doesn't feel it anymore.
You're describing so beautifully just being a parent in that space, and something that I hear from other parents, something that that I think the team I work with, that we hold, even when we're first meeting parents, but don't say anything about it until it feels like it's the right time. And only when they bring it up in their own way. But I hear parents use language of, oh, like this is being a parent. It's the worst possible part of being a parent, taking care of a child as they're dying. But I hear parents that for the parents who have regrets about, oh, we had to kept the chemotherapy going, or we died in ICU, or died under the hands of practitioners doing a code. That they describe missing that opportunity, or they notice it in retrospect, looking back. They're like, oh, I missed part of being a parent because somebody else, because the care that we got wasn't actually aligned with my deepest, truest value as a parent, which is love for my child, and wanting to protect them, as again, as you're so beautifully describing.
Thanks.
When if I were a parent coming to you in your own role as a counselor, struggling with that decision, or maybe if a parent was saying, I just can't face it, or I just can't get into that, I can't cross that threshold. Do you I think you've answered this question already in some ways, but is there, I don't want to be so simplistic to say, was there something you would say to them, because it's not something that you can help with just one in one conversation, but maybe I could ask this: if you're working with a parent with that over time, can you say a little bit about how you would how you would hold them, or how you, your experience, how you hold your own experience in order to help them through theirs?
One thing that I notice when I'm doing when I'm working with someone who has a child that's like near end of life, or they're trying to make decisions, is that I think we all assume that if something is right, then it should feel a certain way. And so we want things to feel good. And so I encourage parents to know that, like, you will know when it's right to stop. You will feel it and you will know this feels right. That does not mean it will feel good, you know? And I think that's helpful for people, to know, like, there's never going to be a time that allowing your child to die feels good. But that doesn't mean that you don't know that it feels right.
Mm.
And I think sometimes for all of us at any age, I think treatment and extending life is more for the other people, just as much for the other people as it is for the patient. And so, I used to say, like, I will, pray for Izzy. I will declare life for her. I will fight for her every day for the rest of my life. And it got to the point where I realized, wow, that you're going to cross a pretty selfish line here pretty soon, because you're doing that for you, you know? So yeah.
Mm. Molly, can I interject with a question that came in while you were speaking, because I feel like it's kind of covering where you are right now. And Deborah asked, what type of support did you seek for Izzy's choice of dying at home?
So we got hospice. We did have hospice. We brought hospice. Again, our base hospital was in Cincinnati, 2 hours away. And so we had to use a local hospice company. And so we did bring hospice in, but they were not pediatric. And the nurses were not comfortable taking care of a child. And so while I don't feel at that point, I knew how to take care of Izzy. We knew how to do all the things. And our palliative team at Cincinnati was guiding me and doing all the things over the phone. I talked to them all the time. So we did bring hospice in, but she was on hospice less than a week. I mean, she was in liver failure when we left the hospital, and we had already had all these conversations, and we were still going to do palliative radiation because she had so many spots in her skull. She had like golf balls all over her skull, and we didn't want her to start having seizures. We didn't want all these things to happen. We were planning on doing palliative radiation, but her liver was just failing. And so we came home, and really, like I said, less than a week.
Mm.
And
go ahead.
I love that, like, I think, I love that she didn't have to be home and wait. But I think that was part of stopping treatment and then taking her to the beach for a month, and leaving the hospital and just not doing the medical things, knowing every day that her platelets could be so low that she could have a brain bleed. And they probably were. But it was a risk we were willing to take every day, just so she didn't have to be in a hospital.
Yeah, I think that just goes to defining the end you want, like you were talking about, and the importance of that, and understanding what the trade-offs are. It's really beautiful. You mentioned doing this with your family, and this is going to feel like a bit of a weird segue, but can you also just talk a little bit about what it was to, care for your family? You have other people as part of this experience too, and what that was like.
Yeah. So I think because our journey was so long with cancer, we just got in these very defined routines, my ex-husband and I. So I was Izzy's caregiver, and I went to Cincinnati with her and stopped working and took care of her. And he stayed home with our son, who was starting kindergarten that first year. And we didn't realize at that time that we were making the choice that we were going to stick with for the next decade. But we were, because Izzy didn't want to switch hospitals. She wanted to keep going there. So I feel like, Izzy and I were together much of the time, and Kendrick and Carter were together much of the time. And that's kind of the way these conversations happened with Izzy and I. And then we'd come back and talk to Kendrick and Carter, Carter lived with so much fear and anxiety because for most of his life, Izzy was in and out of the hospital, you know? And so I think he got very comfortable talking about cancer and talking about chemotherapy. And yeah, I think talking about the end was harder for him because I just think he thought she would have cancer forever, you know? And at the end too, Kendrick and I had her father had different opinions. He wasn't quite ready to be done, you know. That took, and that's okay. I think that's where we have to be able to honor that this is such a sacred place. It's going to take people different lengths of time to arrive there, you know. And so we had to kind of go back and forth, and that was a great time for us to bring him into what was actually happening in the hospital, you know, because she was getting off the scanner refusing to do things because she was like, I am done, you know, I'm not doing this anymore. So yeah, again, we did the best we could with what we had, navigating raising two children in different states. But then ultimately at the end, we saw things differently because I saw what she was going through every single day. And he saw it differently. He would just see her when she came home and she was at her best, which wasn't much, but I hope that's helpful.
Yeah, yeah, absolutely.
Molly, I think I remember you having said something in another conversation just about how you trying to keep a separate, trying to keep a protected space for your son, just to be in and have and be a boy and be a young be a boy and be a young man, and while Izzy was sick. Can would it be right to say a little bit about that?
Sure. I mean, I think some of that, I got very protective of Carter over the years, especially like online on social media. I would never talk about him. So like a lot of people didn't even know that I had a son, and people are like appalled by that. And I'm a horrible mother because I never talk about him. But his life, his only identity is not being Izzy's brother, right? And so, yeah, he is a different kid. They're different kids. Their personalities are totally different, right? He's an introvert. She's an extrovert. She wasn't afraid of anything. He is anxious, a little standoffish of everything, you know? And I think we did the best we could to not make our entire life about Izzy, but ultimately, I mean, it was because that's what we were doing. But in the times we weren't in the hospital, every opportunity we had, we gave him the opportunity to be a kid, to be a boy, to go. They would go, you know, to a Cubs game. They would go to the Reds game, whatever, go do baseball games. And I'll be at the hospital with Izzy because that was his childhood. I didn't answer that question well, sorry.
No, that's beautiful. No, I think that's that's beautiful. And as maybe I think our next slide is about grief, if I'm remembering right.
Yeah.
But we touched on grieving in an anticipatory way. But I wonder if you can say a little bit about what grieving's been like after Izzy died. Maybe for maybe even for the whole family, if that's sure. Right.
Yeah, I think I honestly believed, just by what I saw modeled in our culture, that grief was this season of getting over the loss and getting over the pain. And I now, from my own experience, very much believe it's just getting used to the loss. Grief is the season of getting used to the pain. And those things aren't going to go away, but that was my expectation. And so for me, a couple years out now, I see grief as just this acceptance that her absence is a thing that will go on forever, you know? And so this is just learning to live with that absence and not pretend like it didn't exist. Her absence isn't a thing. So it's like grief for me has become this process of normalizing pain and saying, oh, hey, we can feel pain and sadness, and also feel other things too. We can feel peace and joy. And Izzy felt all of those things every single day. So she modeled it best for me, you know. I think for my son, it has been just such a relief to not have to worry anymore about when something's going to happen to her. Again, to not have to see her not be able to ride her bike anymore, not be able to jump on the trampoline. Oh, then she could do these things, then she could, then she could, then she couldn't, again and again and again. I think he really hasn't grieved yet. And I don't think he will until he's, I don't know, at least he's 17 now. So it's just not like a time to like really press in and explore your emotions. But that's okay. He's got so much peace because there's just like this huge weight lifted off of our shoulders, you know. And I think that for Kendrick too. I think Kendrick's experience with grief was different with mine because he didn't do the anticipatory grief thing for so long, right? So I think grief hit him like a ton of bricks a lot harder than it hit me like right away. Like I was curled up in a ball on the kitchen floor for years before she died, you know? So yeah, and one of those isn't better, they're just different.
And then, thinking again about that parent who may come to you to work with you, are there particular? You're like already beautifully describing and like an orientation and understanding of what grief is. That I think that helps. That I can imagine helps all by itself, just to offer somebody and a way to understand what's happening, or a frame to help it make to come out of the chaos of it. But are there particular, like for somebody who might like just feel a swim in their grief or disoriented, or not even knowing what to try to do to get help? Are there things that come to mind for you?
Yeah, I hope I answer this. So I think the thing, usually when someone comes to me, their concern is they're like, something's wrong with me because I still feel sad. Right? And so I don't do anything to make them feel better, but they feel so empowered to know it's okay that they feel sad. And I think that's really, I can't think of a person that hasn't come to work with me because something's wrong with me. I still feel sad. I still cry sometimes. This holiday's still hard for me. I still get triggered. And once people realize that's okay, that just means you're a human being and you're allowing yourself to feel those emotions. That's like this huge weight lifted off their shoulders. And that's what I think is so important. Then we feel those emotions, and then they don't build up quite as much. They don't have so much control, you know. So.
And you're reminding me of something our Jamaica team hears very often from the parents that we work with, is that they at some point they come to somebody helps them understand that there's nothing wrong with them, that the loss they had was the worst conceivable loss. So 3 years, 5 years, 10 years later, of course those feelings are still there, and then the path towards healing is something else besides feeling better. It's just getting to a place where things are different.
Yes, I agree.
So we are at time, but we have a couple questions. Molly and Chris, are you okay to go a little bit over and get to those? Okay, wonderful. So Jeannie said, Molly, thank you for sharing your experience, wisdom, and Izzy with all of us. Can you please speak about how Izzy's choices and desires were incorporated into the conversations with the medical team as she grew up with that team, and her developmental stages and thinking evolved, given that she had grown up literally and figuratively with cancer?
Mm-hmm. Yeah, I think it was a really cool experience for them as well to see the shift. She basically, I don't know, maybe we were like 2018. She was like, I'm done with treatment. I don't want to do any of it anymore. I'm not doing this. I'm not doing this. I'm not doing it. And what the problem really came down to, we had her meeting with the psychologist and everything. was that we were all making these decisions for her, right in front of her. Literally, she was in a hospital bed and we weren't inviting her into the conversation. And so when we began to say, well, what if you got to pick what you did and what you didn't do? You know, and just for instance, something like, I'm not going to do anything that requires that I have a catheter, right? Something like that, for an example. She was like, she liked that. So she said, you know, yes, I want to start being involved in these conversations. And so that was, I think, the first time we did a scan, and everybody came in the room for it, because everyone was like really kind of excited, because she didn't come on as a child old enough to be involved in these. So they'd never really seen this bridge either. So the social worker came in, and a couple fellows came in, and everybody came in, and we went over the scan results. And he just said, I mean, you can do this treatment. And she was able to ask those questions. And so, is the cancer going to go away? And he would say, well, maybe. And will it come back? Yes. And that's really the thing for her. Then in all the conversations going forward, it was, will the cancer go? Will the cancer come back? And for her to hear again and again, it will always come back. I'm so sorry, but yes, you know. That helped her gauge what she wanted to do and what she didn't want to do. You know, well, then I'm not going to do that thing if the cancer is still going to come back anyways, you know. So it was a learning curve for all of us. And I think, yeah, I'm glad that she brought it to our attention, because she deserved to be a part of those conversations. So, yeah.
Thank you. This next one, I think you both could probably speak to it. Karen said, this feels sensitive and possibly intrusive as a question, so forgive me, but I wonder if Izzy had a notion of the soul, of afterlife, or not, of what happens after we die. Do children, quote unquote, go there in your experience? So this could be Chris, your experience, and also Molly, for you. What was Izzy's thoughts on this?
Yeah, I mean, Izzy very much believed, I mean, she very much believed that her soul was going to go forward. And I mean, when I explained to her, when we were asking questions about what happens to the body when I die, like literally what's going to happen to my body, you know, and that's why she didn't want to be buried, because she didn't want it to like decay. She didn't want to go through that process. And okay, what's going to go to me? What's going to happen to me? And that's where I would say your soul will be set free from your body, you know. And this is where she began to really challenge me and like my religious upbringing, and ask a lot of good questions, like, why do we go to heaven? Like, why do we go somewhere else? Why can't we just be here around the people that we love, you know? And so we had a lot of these questions in the last final day. She was like, I don't want to go up there. I want to be down here around animals, around nature. I don't want to be able to not be in the woods, you know? So I think she had a sense for that. And definitely, I mean, the day before she died, I would say, I don't know what you want to call it, but she saw a little white ball of light, you know, that was like a man talking, you know, which I think is one of those things that everybody says, what is that real? Is that not real? I didn't think anything of it at the time. I thought it was just the Dilaudid. But afterwards, the more end of life stuff that I've studied, I do think she was seeing something, you know.
Yeah, I can say that in my experience, that children absolutely have very rich spiritual lives, and sometimes very surprising, and you won't know until you ask. Though I think we found, like, in talking to kids about the end of life, like, we generally try to sorry, there's a 9-month-old Labrador puppy gone in frenzy just off. The guidance we usually offer parents when they ask is, you know, to answer the questions, but don't necessarily to give them more information than they're looking for. But I think I've seen really beautiful conversations unfold when either child and a parent, or a child and some other someone in the hospital who really loves them, when that person was just curious and asked questions, or answer, or is open to exploring those questions in a way that are oriented towards helping the child not be afraid of what's going to happen to them, and not be afraid for the people they're going to leave behind. And actually that's but we very routinely see kids who do, as they're dying or in the days up until they die, they see family members who are dead, and they and usually in a way that that feels good and reassuring, that those people are there to help the child.
Oh, thank you both so much. Just getting some lovely notes of appreciation for both of you speaking on this subject. Thank you again, Molly, for joining us and talking about your experience and sharing Izzy with us. It's been really beautiful hearing about your experience. Any other, I know we've talked about a lot of things, but is there anything that we didn't get to cover, Molly, that you feel is just important to talk about as relates to your experience or the work you do with other parents?
No, I don't think so. I think we covered it all.
Well, thank you both. Thank you, Chris. Thank you, Molly. Thank you, everyone, for being here. Happy weekend wishes to everybody. Thank you again.
Thanks, everybody.
Bye.